Hello. In this presentation we are going to discuss about dermatoscopic features of basal cell carcinoma. BCC is the most frequent, of course, malignant skin tumor, and it's, I would say, from a dermatoscopic aspect, is one of the more featureful tumors, meaning that usually we see many dermatoscopic structures and several of them are quite characteristic or even specific for basal cell carcinoma. So it's definitely one of the tumors that dermoscopy significantly enhanced its recognition. And in fact, there is a long list of dermatoscopic features that have been associated to basal cell carcinoma in multiple studies, starting from the very preliminary era of dermoscopy in 2000, and then later on additional studies enriched the long list of dermatoscopic criteria of basal cell carcinoma that you can see in this slide, or you can see in this table from a review paper, or you can see in this panel of images with this very well-known and beautiful criteria. Now, to make it a little bit simpler, I will try to classify the BCC criteria in four main categories, which are the ones that you can see in this slide. And these four categories are vessels, pigmented structures, ulceration, and white color, interestingly enough. Starting from the first one, vessels, we know pretty well that BCC is a vascular tumor. BCC is a tumor in which we usually do see vessels, and also these vessels are quite characteristic, quite peculiar in their morphology. They are linear, they are stem vessels, large diametered vascular structures, which are long, so they cross large parts of the lesion. Usually they cross the center of the lesion, and then they are ramified or branched in thinner vessels, and then even thinner, and finally to thin capillaries. So just like the arborizing tree structure. So that's why we call them arborizing vessels, or ramified vessels, or linear branching vessels. And typically in their ideal version that you can see in this slide, they project quite in focus. In focus means that they project bright red to our eyes when we use our dermatoscope. They are not blurred in their appearance. Here you can see one more classic example of the arborizing vessels of BCC. Look at them. They are large vascular structures ramified to thinner and thinner vessels. And of course they are also long, so they cross the lesion. Practically they cross all over the lesion. One more example, not that much typical as the ones we saw before, but still it's clear that there are vessels that they are linear in morphology and they are ramified to thinner vascular structures. One more example, again not so prominent as the ones at the beginning, but clearly present vessels, linear in morphology and ramified. Now, concerning these arborizing vessels of basal cell carcinoma, I need to underline that although they are very frequent in BCC, so they are the most frequent criterion of basal cell carcinoma, but keep in mind that these vessels are not absolutely specific for basal cell carcinoma, since we can see very similar vessels in other tumors, especially in the category of adnexals. This is an example of an adnexal, a benign adnexal tumor, which displays vessels that are really similar to the ones we saw before. Of course, in this example, maybe you can see that the vessels are not that much in focus. They are not so bright red as before. They are a little bit more blurred, but obviously this difference is not easy always to discriminate focused from unfocused vessels. So to be honest, these vessels are quite similar to the vessels we saw before. So arborizing vessels are very frequent in basal cell carcinoma, but not 100% specific. One more example, linear ramified vessels. In this occasion we also see a blue clot in the lower part, and as I will show you in a minute, this blue clot is a highly specific feature for the diagnosis of basal cell carcinoma. Then the second type, morphologic type of vessels that we see in basal cell carcinoma are the so-called short, fine telangiectasia. What is this? These are again linear vessels, but much shorter and much thinner and not ramified usually. They are just linear vessels. This is the type of vascular structures that we see in superficial basal cell carcinoma. So obviously these vessels, these short fine telangiectasias, are not that much prominent as the arborizing vessels we saw before, but still from a differential diagnostic perspective they are quite helpful, especially if you consider which is the main clinical differential diagnosis of superficial BCC. So usually superficial BCC has to be discriminated from Bowen's disease or from flat papules or macules of inflammatory dermatosis such as psoriasis or dermatitis. So if we put it in this context of the clinical differential diagnosis, then the vessels become really helpful for the diagnosis of superficial BCC. Why? Because as I show you in this slide, all the other entities of the differential diagnosis display dotted vessels. So Bowen's disease on your very left, dotted vessels. Psoriasis and dermatitis, dotted vessels. The only tumor of this differential diagnosis that does not display dotted vessels is superficial basal cell carcinoma, okay? Which displays short linear vessels, not dotted ones. Or sometimes, as in this example here in the right hand side of the image, this superficial BCC, to be honest, here we can hardly see vessels. There are almost no vessels at all. This is the case in superficial BCC. So it's not, vessels do not predominate in superficial basal cell carcinoma. If we see some vessels, they are not many and they are short and linear, okay? So BCC vessels are always linear, predominant, large and ramified in nodular basal cell carcinoma, short and thin in superficial basal cell carcinoma. Diagnostic category number 2, pigmented structures. They are much more specific than vessels for the diagnosis of BCC, much more diagnostic than vessels for BCC. Why? Well, because they are very, very, very peculiar in their morphology. They have a unique morphologic appearance which cannot be easily confused with something else. I'm speaking, of course, about these beautiful features with the metaphoric names like leaf-like areas, spoke wheel areas, these strange projections, pigmented projections that originate from a common base and are unique in their structure. Look again, one example of the so-called leaf-like areas or linear projections originated from a common base, if you prefer the descriptive terminology. The names are not so important. What is more important is the fact that these features are highly specific for basal cell carcinoma. And of course they might look like the streaks of melanocytic tumors, but there is a big difference. The difference is that streaks of melanocytic tumors originate by definition from the pigmented central part of the lesion, while in BCC there is no pigmented central part of the lesion. In BCC, these linear projections are not associated to the center. They stand alone like islands of pigment, not connected one to the other. Look here again from the close-up, the difference between streaks and leaf-like areas. And one more example of another version of the same feature, the so-called spoke wheel areas with the black center and the radial projections originated from this black center. So spoke wheel areas, again, basal cell carcinoma here at a higher magnification, this very characteristic feature. And one more example, look in the circle, the spoke wheel area of basal cell carcinoma. Now, there are a few additional variations of the same feature practically. So leaf-like areas and spoke wheel areas are obviously, as you understood, the very overlapping features. So is the so-called concentric structure that I highlight here in the circle. Again, pigmented center and a little bit less pigmented halo. The only thing missing here are the radial projections of a spoke wheel area, but in fact they are very similar structures. And finally, sometimes in BCC we see this scattered brownish pigmentation, which has not taken the form of a spoke wheel area or a leaf-like area, but still it remains highly diagnostic because this scattered distribution of brown dots is not common in any other diagnosis. Okay, so in melanocytic tumors, when we see brown dots or brown globules, they are aggregated, they are close one to the other. When we see a scattered distribution of pigmentation, this is a strong clue for basal cell carcinoma, which I have renamed as the Pollock sign of BCC, of course, from the famous painter Jackson Pollock, who was painting in a similar way, and that's why the painting looks so scattered in terms of the color. Similarly, in BCC, pigmentation is scattered and not aggregated. That's a very, in my view, useful clue. So this is the first type of pigmented structures in basal cell carcinoma, very highly specific for BCC. And then there is a second type of pigmented structures, the blue colored. Of course, I'm speaking about the very well-known blue ovoid nests, which are blue roundish structures. And when these nests are smaller in diameter, maybe we call them blue globules, such as in this example here, blue globules. Also, they are very highly diagnostic of basal cell carcinoma. And also here, if you see the distribution of these blue globules in the lesion is again scattered. So the Pollock sign is also here valid. You see that these globules are not associated the one to the other. Okay, so the Pollock sign is also here working. Look, this BCC, which is not that much easy to diagnose because we see quite a lot of white color, and white color usually makes us think of keratinizing tumors. But at the moment that we see the blue clots, then practically any other diagnostic probability disappears and only BCC remains in the game. One more example, a BCC with blue clots. No doubt at all diagnostically, since we see blue clots, basal cell carcinoma. One more example, blue clots and nests, basal cell carcinoma for sure, even if we don't see vessels in this example. So pigmented structures are highly diagnostic. Number 3, ulceration. Well, ulceration belongs to the BCC criteria, is included in the list of BCC criteria. Although, as you can understand, ulceration cannot be considered a specific feature because any tumor might be ulcerated. It's true that basal cell carcinoma is ulcerated more frequently as compared to squamous cell carcinoma, for example, or as compared to melanoma, for example, and it's also ulcerated usually at an earlier stage as compared to the other tumors. So it's true that ulceration is somehow a clue of basal cell carcinoma, but obviously not specific. Now in BCC, sometimes we see a large ulcerated area, such as in this example here, or in other cases we see more than one smaller, obviously, ulcerated areas, as in the example you can see here. And this is what I told you before. An ulcerated BCC on your left hand side, an ulcerated SCC on the right hand side. If you are able to tell them apart, you can do it not because of the ulceration. The ulceration is very similar in both. What is different is, for example, the linear vessels on your left and the white circles surrounding follicles on your right. But the ulcerated area is very similar, one to the other. And in fact, if the ulceration covers large parts of the lesion, like in these two examples here, then you cannot anymore differentiate the ulcerated BCC from the ulcerated SCC. So ulceration is obviously not specific, although it's more frequent in basal cell carcinoma. In superficial basal cell carcinoma, we see a different type of ulceration and more superficial version of ulceration, the so-called multiple small erosions, these yellowish, small, yellow-brownish, small structures, which are a very nice clue to diagnose superficial basal cell carcinoma. In fact, in my opinion, they are the best clue to recognize superficial basal cell carcinoma. Look here, another example of superficial BCC in which practically the only clue we can see are these multiple small erosions. And one more example, look, superficial BCC in general is featureless. We don't see much, unless there is pigmentation, of course. But if not, then we don't see much. You see here a combination of white and pink coloration, but without prevailing structures. The only thing that helps are the erosions, the multiple small erosions. Finally, last clue of basal cell carcinoma is surprisingly the white color. I say surprisingly because you probably know, and it's true that white color is mainly associated to squamous cell carcinoma, to keratinizing tumors. Obviously, keratin is white. However, white color can be seen also in basal cell carcinoma, and let's see now in which forms, in which ways, in which morphologic structures white color can be present. First of all, translucency. Basal cell carcinoma is translucent. You know it, we all know it, because it's a clinical clue also. This translucency of the tumor, this whitish translucent hue that makes you believe that you can see behind, that's translucency, is also seen with the dermatoscope. For instance, look at this, the overall whitish translucent hue. Okay, so this is the first thing. Or look here again, translucent tumor. Okay, translucent hue. Then another white colored structure that we see in BCC is this one. So the so-called negative leaf-like areas. What are the negative leaf-like areas? If you follow the outline of this basal cell carcinoma at the periphery, you will see that this is a BCC developing on a severely sun-damaged skin, and if you follow the outline, you will see that within the borders of the basal cell carcinoma, within the margins of the basal cell carcinoma, the solar lentigines are not visible. Okay, and this gives the impression of a negative leaf-like area, white-colored leaf-like area. So this consumption of the Landy genes is an additional clue to diagnose basal cell carcinoma developing on sun-damaged skin. One more example, look at the lendigenous skin surrounding the tumor. There are everywhere Landy genes, but inside the tumor, and if you follow the outline, you will see that all over the surface of the tumor you cannot see the Landy genes, okay, negative leaf-like areas. Then, speaking about white colored, today we know also a type of white shiny structure associated with basal cell carcinoma. White shiny structures are those that you can see only with polarized light, and they are shiny, in fact, such as the rosettes, such as the white shiny streaks. So for basal cell carcinoma, the clue associated here with this diagnosis are white shiny blotches and strands, which is the difference between blotches and strands as compared to lines and streaks. Well, blotches and strands are thicker as compared to lines and streaks, okay? Here you can see another example of these white shiny blotches and strands. So lines are thin, strands are thick, and blotches, of course, are even thicker. Let's see in comparison the white shiny blotches and strands of a basal cell carcinoma as compared to the white shiny lines of a melanoma, in order to understand the difference. One more example, white shiny blotches and strands on your left hand side, white shiny lines on the right hand side. Okay? Finally, last clue recently described for basal cell carcinoma are the so-called aggregated yellow-white globules, May globules, multiple aggregated white yellow globules. It has been described recently for basal cell carcinoma, and it has also been associated with aggressive histopathologic subtypes. Look at this panel, and you will see these yellowish to white aggregated globules in all of these images. You might think that there is an overlap with the white clods of a sebaceous hyperplasia, but in a sebaceous hyperplasia, you know that these white clods are very regularly arranged, and they are surrounded by linear crown vessels at the periphery. But morphologically, they look quite similar. Of course, here they are aggregated and not symmetrically distributed. Look again here, a basal cell carcinoma with clear-cut vessels, of course, but also on the right-hand side with multiple aggregated white globules. Okay, so I would say that this is the summary of the dermatoscopic features of basal cell carcinoma. Let me recap for a moment before I close. The most frequent criteria are vascular structures, linear vessels in basal cell carcinoma, predominant, large and ramified in nodular subtypes, not so predominant, short and thin in superficial basal cell carcinoma. Then pigmented structures, they are quite frequent and very specific for BCC. They are subdivided in two categories: brown color, superficial BCC, that's why the color is brown, and they include leaf-like areas, spokewheel areas, concentric structures, all these very peculiar shapes. And then blue-colored globules, nests. Remember here the scattered distribution, the Pollock sign of pigmented structures of basal cell carcinoma. And finally, white color, although not predominant, but it might be present in basal cell carcinoma in the form of translucency, in the form of these white negative leaf-like areas or white shiny areas, and finally white shiny blotches and strands, which of course can only be seen with polarized light. Okay, that was it. Thank you very much for your attention.